This is how a typical viral conjunctivitis is present. Like bacterial conjunctivitis, viral conjunctivitis is an inflammation of the conjunctiva, but it is caused by virus, not bacteria. The exact virus known for causing viral conjunctivitis is adenovirus. The virus is highly contagious, meaning it can easily be transmitted to others. This is because the virus can survive on dry surface for long, so people often get infected with the virus without knowing. Viral conjunctivitis is of many types, but the most commonly occurring type is epidemic keratoconjunctivitis, commonly known in our contemporary society as Apollo or pink eye, and it is caused by adenovirus type 8, 19, and 37. Epidemic keratoconjunctivitis is our main concern in this video. It's an inflammation of the cornea and the conjunctiva of the affected eye. As the name implies, kerato meaning it affects the cornea and conjunctivitis meaning it causes the inflammation of the conjunctiva. And the word epidemic means it is a widespread disease. Diagnosis. These are the four major signs identifying viral conjunctivitis, whether the epidemic keratoconjunctivitis or the other types. We have hyperemia or redness of the eye, lid edema or swelling of the lid, and watery discharge or clear discharge, and chemosis meaning swelling of the conjunctiva. Among all these signs, the main sign identifying viral conjunctivitis is this watery discharge or clear discharge, which is in contrary to that of bacterial conjunctivitis that is mucopurulent or thick creamy discharge. The major symptoms the patients often complain about are irritation or pain and photophobia, which is an excessive sensitivity to light. And this is because epidemic keratoconjunctivitis affects the cornea of the eye. As we know, cornea of an eye can be described as a window through which light enters the eye. So anything that can affect the cornea can cause photophobia or fear of light. Therefore, an acronym for the symptoms of viral conjunctivitis is PI, which I know most people can recall what PI is. So the P stands for photophobia and I stands for irritation. Treatments. Viral conjunctivitis resolves on its own within 2 weeks. However, medications are prescribed and certain measures are taken for symptomatic relief. Topical steroids such as dexamethasone eye drops are prescribed to reduce the inflammation, especially in severe cases. Cold or warm compresses are applied several times a day using a clean cloth for symptomatic relief. And the second measure is using artificial tears for replication 4 times a day. Therefore, an acronym for the treatment is CAT, C-A-T. The C stands for cold or warm compresses, A stands for artificial tears, and T stands for topical steroids. The general preventions for pink eye are well explained in our previous video on viral conjunctivitis. I suggest you have to watch that video if you didn't, especially because of the season we are in now, to protect yourself and your loved ones. The link is in the description below this video. Kindly subscribe and turn on notification for more videos of this like. See you next.